Hi, let's talk about the ventilation pathway. The ventilation pathway is going to consist of all of the structures that move air in and out of the alveoli from the nose and the mouth. And so we've already discussed the nasal oral cavity and the pharynx in other sessions. Let's kind of pick up the thread at the larynx, or the voice box. Recall that the larynx consists of several cartilages, one of which we can see here. This is the thyroid cartilage. And that thyroid cartilage is going to sit atop the cricoid cartilage. The cricoid cartilage is the only cartilage that is 360 degrees contiguous about the airway. And between the two of them is a membrane that is part of the conus elasticus called the median cricothyroid membrane, which is generally just referred to as the cricothyroid membrane because most people don't give the lateral cricothyroid membranes their props. Nevertheless, it's this median cricothyroid membrane which is incised during a cricothyrotomy. And we can see the boundaries between the thyroid cartilage and the cricoid cartilage there. So that is the median cricothyroid membrane. The larynx sits atop the trachea. The trachea is going to descend the remainder of the neck and the superior mediastinum. We can see that the thyroid gland here has been cut and reflected away. That trachea is going to bifurcate into primary or main stem bronchi. So here is the right primary bronchus, and here is the left primary bronchus. And this bifurcation occurs in the thoracic plane. That thoracic plane is an imaginary plane that begins at the sternal angle. That's the osteological angle between the manubrium and the body of the sternum. Posteriorly back to the intervertebral disc between T4 and T5. Now, right at that thoracic plane, if we turn our attention over here, we can see that within this bifurcation, there is a carina. Carina means keel, and so that is the ridge here that is separating left from right primary bronchus. Now, here is an endocast from the tracheobronchial tree. This gives us a very good image as to why we refer to it as the tracheobronchial tree. Hint, just imagine it upside down. The first thing that I really want to point out to all of you is this is very much a posterior view of the tree. That's going to be important. So here we can see this is the cast of the trachea descending down, and then here is the right main stem bronchus, so right primary bronchus, and then here is the left primary or main stem bronchus. Let's take a look through each of these to see what we are able to discover. So on the right, the primary bronchus is going to divide into the superior lobar or secondary bronchus. So that is the superior secondary, as well as the bronchus intermedius. That bronchus intermedius is going to be an intermediate pathway to the next two secondary bronchi. So there's the secondary bronchus for the middle lobe, and then the secondary bronchus for the inferior lobe. Whereas on the left, there are only two lobes, and so we have the secondary bronchus for the superior lobe and the secondary bronchus for the inferior lobe there. On the left side, we also have a lingular bronchus. That lingular bronchus is in association with the superior lobe. And we can see that lingular bronchus right there. The other particular pathway of the tracheobronchial tree that you want to be aware of is a tertiary bronchus that supplies the superior segmental bronchus of the right inferior lobe. And we can see that right there. This is the tertiary bronchus for that. Recall that the superior segmental bronchus of inferior lobes are the only tertiary bronchi that are going to be oriented posteriorly, such that if an individual is confined to their bed and lying supine for an extended period of time, there's an elevated risk of fluid accumulation in that particular bronchopulmonary segment. We can also see a variety of other tertiary segments, and you could be called upon to identify them as tertiary segments, but not particular tertiary segments throughout. And then finally, we can see some of these elements on the right portion of the tracheobronchial tree. So the right primary bronchus has really been interrupted here. I can see there's the secondary bronchus of the superior lobe. Here we have the bronchus intermedius. Here is the secondary bronchus of the middle lobe. And then here is the secondary bronchus of the inferior lobe. And then oriented posteriorly here, we have that tertiary bronchus that is serving the superior segment of the right inferior lobe. And again, we have many other tertiary bronchi throughout, none of which you will have to identify the particular bronchopulmonary segment to. So we've discussed the various elements of the tracheobronchial tree. The trachea, the primary or main stem bronchi, the secondary or lobar bronchi, and the tertiary or segmental bronchi, as well as features such as the lingular bronchus and the bronchus intermedius and the superior segmental bronchus of the right inferior lobe. Thank you very much for your time.